listened to it. I learned how to understand it. I was exploring that, and wow, you know, people had biographies and they had stories that were intimately connected to their illnesses. And they needed their doctors and their drugs and their therapy and their healers also. This isn't instead of, this is the salt in the soup for the healing and the meaning and the message. And you know, when I teach at the Senior Center and I mention Tuesdays with Maury, and people smile, people are smiling in the audience now too. It's like, you know, what are you smiling about? The guy died of amyotrophic lateral sclerosis, a wasting away of muscles and nerves. But we smiled because we saw he chose how to have that disease. He took responsibility for it, and we didn't see him. You can't smile if you see him as a person dying of amyotrophic lateral sclerosis. You see him as a person laughing and telling stories and making humor and finding a way of being with his disease. And that's where, you know, Viktor Frankl from Man's Search for Meaning and the Holocaust, everything can be taken from a person but one thing, the right to choose one's own way. So I ask people to choose a way, choose your path. You know, if you want the path of healing, I'm not going to fix you. I can give you herbs and vitamins and treatments, and you can see your doctor and you take your drugs, and if it works, great. But if you're in my office, something's still missing that we have to find. That's my job to help you look for in that way. So this person, as Louise mentioned, I do lecture a lot locally. The person would come to the audience and he would follow me out to my car and say something like, Dr. Epstein, I have everything wrong with me and I'm crazy and nobody's helped me. You think you can help me? And I'd say, well, let's give it a try. Give me a call. We'll see. I don't know. I always try to have a beginner's mind. This is what we'll work on for those coming to the workshop that I'm doing afterwards. It's like, how do we cultivate a beginner's mind and non-judgment and presence and patience and trust and allow it to be with somebody? And this is the person who taught me that, this patient of mine. And he was right. He finally came to see me, again, cutting the story short. He finally came to see me and he had everything wrong with him. He had asthma and he had allergies and he had digestion and he had skin problems, and he's 22 years old. Well, I knew there was some biography there, but he wouldn't tell it to me. And he wouldn't participate in relaxation, and he wouldn't change his diet, and he wouldn't take the homeopathic remedies that I prescribed for him, or anything. But he kept coming. And I kept going, so what am I going to do with this guy? And I didn't know psychodrama then, because I could have done some psychodrama. I could have tried something, right? Because I knew what he needed, but he wouldn't do it. And at this time, just to share my own story, I started studying with John Wellwood, Psychotherapy in a Spiritual Context, who's a Buddhist and a psychologist. This book is out there, Psychology of Awakening. And we spent years as a group working together, just being present with the pain. Just let people cry. Let them feel it. Don't fix it. But let them know you're there, that you hear and you care and you listen. And you say, I hear you. And their presence is what does the healing, not what they do, who they are and how they be. And I'm ready to refer him because I don't want to take his money anymore, and he's not getting better. And I say, well, why not practice? Maybe it works, When all else fails, love him. And I let go. I'm not going to try to get him to do anything. And if you can imagine, I wasn't a white coat, stethoscope kind of doctor. I was pretty laid back and, pretty easy and relaxed in terms of my style and my office. Not very medical or clinical, but still, And it was amazing. He started to respond as soon as I just said, I love you. I accept you. There's nothing wrong with you. I'm not going to try to treat your asthma or your allergies or your digestion. I'm just going to be with you in a loving way. And I wasn't doing it to be therapeutic. I was doing it because I hit my bottom of being a doctor trying to fix people, right? Okay? And that's, again, what the healing is. I had a center in Israel. To train therapists, not to cure people, is not an easy thing. To let them be. All right? So we have to, that's the work. John Wellwood, I had already been a Buddhist. I wanted to learn more therapy. I was with psychologists and psychiatrists. They wanted to learn meditation, but they kept asking him, how do I do this? And he kept saying, there's nothing to do. This isn't about, they want to take notes and, whatever the case may be. So make a long story short, he started to heal. He took the remedy, he changed his diet, he did the things that would help him naturopathically. He got well, his consciousness changed and all of this, and he actually went to naturopathic school, and now he's a good friend of mine. And I have to honor him by saying, he says, you know, when you lecture, can't you find another story to tell besides mine? I don't tell his name or whatever. So that's what he taught me. You know, he taught me, it's okay, I don't have to know the answer. You just came from experts for years at the Mayo Clinic, trust me. And they didn't have the answer. And they were the experts, because they know a lot about that. But they don't know about that, and they're not asking who you are and are you willing to listen. And they're not loving you. And they're not negating, I'm not being judgmental here, I'm just the context of how we understand what healing is. So that brings us to the last question of the three. And the last one is, you know, that's the question that I live now when people ask, well, what do you do? You know, well, I'm a naturopath. Well, what is that? Or I do mind-body medicine, or I do another therapy I will not have time to speak about very much now, internal family systems therapy, which is kind of like psychodrama and talks with our parts and integrates them and emphasizes that self-energy of the healer within each person, which is the essence of naturopathic care, vis medicatrix naturae. The healing is within, the learning is within. Touch that place and let it shine itself. It's not we have to give it to them. They have it, we have it, and when we allow it to go to work, it does its thing. We're just creating the space for that. So the question is, how can I be with my pain in a way that's wise, compassionate, and healing? I've been in practice over 20 years. No one has ever called me on the phone and said, Dr. Epstein, can you help me be with my pain in a way that's wise, compassionate, and healing? No one ever called me and said, Dr. Epstein, can you help me listen to my body and help me understand the meaning of my disease and my symptoms? No one ever called me and said, I want to find out how I came to be this way. Can you, I mean, my point being, from a consciousness shift of seeing things differently, part of my mission and passion is to just support us from the standpoint of a lot of times we're bringing the body now into psychotherapy. You see that on the networker. And I think my work is bringing kind of psychotherapy or the mind, emotions, attitudes, belief, biography into medicine. That we all have to be in it together, treating the whole person. And you know, when a patient comes to me with chest pain, they go to the cardiologist immediately. Or if I feel their lack is on the spiritual level and they're not interested in my understanding of spirituality and Buddhism, I'll send them to someone like Linnea to work with them on a spiritual level if they're into, you know, whatever they may be into. Okay? So it's helping the person find what's right for them and where their healing is, and engaging them in that process to take responsibility. I'm just speaking again for how that's happened for me. So the last story to share is a woman who came at 75 years old, had tremendous pain in her back and spine from osteoporosis and arthritis of 2 years duration. She went to conventional physicians and got antidepressants and got painkillers and got medicines and surgeries and pain, all of that. She saw a naturopath who worked with allergies and her adrenal glands and stress. And then she came to see me. I'm often, unfortunately, not the first person people end up with. Even though holistic medicine, naturopathic medicine, healing is becoming more prevalent, people still go to, you know, the conventional approach first. As an aside, from a mind-body medicine standpoint, there's a lot of science in what I'm sharing with you. Both neurobiology, neuropsychiatry, neuropsychology, psychoneuroimmunology. This is not the context of this talk, but Kathy put something out about the mind-body connection, the science, and the brain. So, and what we're learning is love heals. Love heals. You know, it's in our cells. The cells have consciousness, and it permeates our being when we're filled with love and when we convey that. And when we be that, and when we share that,